Mr. Sir, please, you mentioned these COPD studies.
Yeah.
So can you explain this, or can you also tell us a bit more about it?
Yeah, of course I can, yeah. It's up to you, Amy. Yeah, Amy's going to step up, yeah.
I don't know if I can model it. Thank you. Hi everyone. My name's Amy Blakemore. I'm from the University of Manchester. I'm a lecturer in mental health actually, but I have a background in working with people who have COPD. So a condition that Ruth and Chris mentioned earlier, chronic obstructive pulmonary disease. You may know people who are perhaps older who have that condition, have problems with their breathing. And there's a really effective treatment for COPD that Chris mentioned before, which is pulmonary rehabilitation. But what we know is when we've looked at the evidence and the research that's out there, is that access to pulmonary rehabilitation isn't always equal, and that people from South Asian communities are less likely to be told about pulmonary rehab and to be referred to pulmonary rehab. And when people are referred to pulmonary rehab, they may be more likely to drop out of the programme before they complete the programme. So the programme involves education about living and managing COPD. It also involves exercise. It can involve some psychological components as well, all to support you to live better, to breathe better and keep active, I think, as Chris said before. And what we really want to do is really understand what the barriers are that are keeping South Asian people with COPD from attending and completing pulmonary rehab. So we have a research project which is funded by the National Institute for Health Research, a government organisation. So we're really invested in this in terms of really understanding this and coming up with a better solution. So we're going to be working on this for about 18 months, starting in February. And what we're going to be doing is wanting to speak to people with COPD. Sorry. Oh, do I have to wear it? Oh, sorry. Hang on. I'm just going to hold it because I can't. Will that work? Yeah. Okay. Where was I? We're wanting, so we're starting in February. And what we want to do is speak to people from the South Asian community who are living with COPD and understand their experience first of living with COPD and understand if they've heard about pulmonary rehab before. If they have, then have they been referred? Has anyone ever talked to them about it? If they've been, how did they find it? Did they complete the programme? And what did they like about it? Or what would they like to see differently, done differently, that would help support more people from the South Asian communities to access pulmonary rehab? And we'll also talk to health professionals who deliver pulmonary rehab about the changes we can make to the programme. And we'll talk to kind of national, what we call key stakeholders or key informants from across the country who are involved in commissioning pulmonary rehab and writing the guidelines for pulmonary rehab so that we can come at this from every angle, if you like. So by the end of our 18-month project, what we hope to have is a culturally adapted version of pulmonary rehab that's going to be more accessible, more acceptable, and easier for people from the South Asian community to access. And we'll also hopefully have developed a community engagement strategy to talk to more people from the South Asian community about COPD. So if people are starting to experience breathlessness and symptoms that could be COPD, then they're more likely to go and get those symptoms checked. They're more likely to perhaps have tests that might mean they're diagnosed with COPD, and then they can access this really effective treatment as well. So over the next 18 months, we'll be working with Chris's team, like he said, and the team from Leicester as well, to find people who have COPD who are interested in talking to us. So it may be that hopefully I'll come back at some other time and talk a bit more about this project. and also other research projects that we have ongoing at the University of Manchester, which often might be around other long-term conditions or mental health and psychological care as well, that we could talk about. We could perhaps do a seminar at some point. So I hope that was okay, just off the cuff. But thank you very much for the opportunity to come and meet everyone today.